to the Checkable Health Podcast. This is your host, Patty Post, founder and CEO of Checkable. Today, I'm continuing a conversation that's really important for expectant moms or moms that have recently delivered and are breastfeeding their children, or even someone that is hopefully having an expectant child. I'm really digging into how to prepare for nursing your baby and what to expect. And today I'm talking about Nest Collaborative, and we're learning about the services that they offer to help moms and what they can do to use their services to have the best practices with nursing. So my guest today is Dr. Lilly Hubschman Shahar. Dr. Lilly, it's very nice to meet you.
It's nice to meet you. You can just call me Lily.
Okay. Well, I always we talked before the show. Tell me about your credentials. How did you get your doctor in front of your name?
So I'm actually a nurse practitioner by training. I'm a neonatal nurse practitioner and a former neonatal nurse working in the neonatal intensive care unit for the majority of my career. And through that, I am just sort of naturally a very curious person and always want to do the best for my patients. And so went back to school for the terminal clinical degree in nursing, which is the Doctor of Nursing Practice. And along the way, also got my certification as an international board certified lactation consultant, which is part of the way. Through that and my doctorate is how I found my way to Nest.
Wow. So how many lactation consultants do we have in the U.S.? Do you have a figure for that?
Yeah, there's about 18,000, 19,000 in the U.S. The U.S. is definitely, it's an international certification, so it's all over the world, and those of us who are IBCLCs can practice in other countries. But the U.S. has far more than any other country in the world.
And there are roughly 3 million babies born a year in the U.S. So the number of lactation consultants to babies is like 1 for every 20 born, if not more. I can't do the math in my head.
Yeah, but it's not enough. It's not enough at all. And in 2011, actually, the U.S. Surgeon General made some recommendations for how many lactation consultants there should be per baby born in the U.S. And there are very few states that meet that recommendation. Although we're really proud that at Nest, with the number of IBCLCs we have, when we're able to provide care in that state, and we do provide care in all 50 states, that we actually help a state to meet that standard just by providing care in the state. And in some states, we actually double or even triple access to care just by providing care in that state.
Oh my gosh. Okay. So let's talk about Nest, because you're providing care through technology. Mm-hmm. And let's talk about what the mission is behind Nest Collaborative.
Yeah. So we're the country's largest virtual lactation support practice. We have only international board certified lactation consultants, which is the gold standard in lactation support. Some of us have other certifications, and others are just really talented IBCLCs in their own right. And so what we do is we provide lactation support just like you and I are talking right now. So virtually, we use our cameras, and we use the parent senses, we use our senses, we use guided examinations in order to provide evidence-based, family-centered, goal-based support. And traditionally, lactation support has been very, very hands-on, and there's a little bit of a movement through some of us as IBCLCs to sort of take our hands off of the patient a little bit, both from a consent standpoint, but also because it's very empowering. And that's really what we find at Nest, is that by not putting our hands on the patient, by giving the adult patient the opportunity to use their senses, to use their finger to feel how their baby's suck feels, or to use the muscle memory of how to set up a latch with our guidance, that it's really empowering for the families in a way that having your hands all over somebody else is not.
Mm-hmm. Yeah, and it's less invasive if you don't have someone that's hovering over you. I can see how that's very empowering.
Yeah, it really is. I mean, obviously, it's not for everybody. There are certainly some people that, despite all of our talents, still feel like they want someone there literally holding their hand, and that's okay. That's their right. But there's a lot that can be done over telehealth. You'd be very surprised, and our patients are extremely satisfied with the support that they receive, and they They breastfeed longer than the average parent in the United States, which we're very proud of. But we also know that that's not the whole story. It's about each patient and their goals, and how can we help to ensure that that patient has the appropriate information to set up their own goals based on their context, and meets their goals, in addition to what the goals the healthcare community has set for parents in this country.
How many moms are breastfeeding these days? What percentage of moms?
Well,
pretty high.
that's a really complicated question. The numbers actually got a little bit worse over the COVID period. About 80 to 85% of parents in the U.S. start breastfeeding, but the World Health Organization and the American Academy of Pediatrics recommends exclusive breastfeeding for the first 6 months, and continued breastfeeding with the introduction of some nutritionally appropriate complementary foods starting at 6 months and continuing on for at least 2 years. And right now, the CDC's breastfeeding report card, which is really the best data that we have about breastfeeding right now, indicates that somewhere between 20 and 25% are exclusively breastfeeding at 6 months. So really very few people are meeting the recommendations. But there's a lot of reasons for that. And I think there's a lot of finger pointing at the families, when the reality is that our society is not really set up to support families that choose to breastfeed their babies.
How so? Why do you say that?
Well, family leave. We don't have consistent family leave. We don't have paid family leave. Although it's legal to breastfeed your baby in all 50 states, it's sort of socially frowned upon often. There's a very big push with the formula industry. They have a lot of money from the dairy industry that influences families often in ways that they're not aware of. And that's not to say that there's not a place in this world for formula. There certainly is, but families are often not aware of the impact of predatory marketing. And so, I mean, that's just a couple of the many ways that we've set ourselves up for to not be able to meet the recommended standard that helps our families to really grow and flourish and be healthy in a way that they could be.
How does Nest, so is it you do it while you're in the hospital? Like, for listeners that are wanting to explore this option, tell us about that.
Yeah, so we provide what we use is something called a preventive care model, which is proprietary to us. We basically say the traditional way that lactation support has been provided is you come to us when you have a problem. So mastitis or vasospasms, or I think my milk supply is low, or I want to, it's biting, any of the multitude of issues that can happen. We say, forget that. Let's help you before those things happen. And if they happen, we can help you through that as well. So we really try to see patients prenatally if we can. There's a lot of evidence to support the positive impact on breastfeeding self-efficacy and breastfeeding duration for patients that receive prenatal breastfeeding support. So we have sort of a structured set of things that we discuss with our patients, but it's tailored to each individual. And then we see our patients at different intervals postpartum from, we can see you inpatient if you'd like, although inpatient is probably the most likely place you are to find another IBCLC, all the way through your weaning journey. So we'd like to see you, before you return to work, before you start solids, before you're thinking about weaning, and for all those things that might happen in between. We use both a preventive and an acute approach to try to meet your every need, because the reality is that we're kind of the only people out there that are really holding your hand the whole way through.
So are you a subscription based?
No, so patients come to us. It sort of depends a little bit on how patients come to us, but if you're coming to us off the street, you can go to our website and book with any one of our IBCLCs based on time or based on selecting the IBCLC, myself included, although I don't see as many patients as my colleagues do because of the other things that I do for Nest. And we'll see you for your prenatal appointment, or if you already have a baby, we're happy to see you for a postpartum appointment for that acute situation that you're dealing with, or those acute questions, or hey, my baby's a month old, or probably a better example is, hey, my baby's 4 months old and is really distractible at the breast, and I'm worried that my baby might be weaning, and we're able to sort of, reset expectations so that you can meet your goals, or you can know what your goals are, and get to that, whatever that next step is for you and your family, whatever's right for you and your family.
Oh, it sounds so nice. Because that's what it
very
is.
supportive.
Yeah. Yeah.
It's a feel-good job.
It feels really nice. Now, what are some of the things if you are pregnant now and you're preparing for nursing and in your mind you want to do it for 9 months? What are some of the ways to best prepare for a woman like that?
So the two top things that I would recommend are number one, and they're sort of related, is number one, find your support system. Figure out if you have a partner or a co-parent that's parenting with you, make sure that you're aligned on what your goals are. Do you have a community around you that may or may not be supportive? What do you know about breastfeeding? Have you chosen gosh, I'm stumbling on my words here. A pediatric provider or a birth provider that is supportive of your goals? Is your work, if you're working, supportive of your goals? Is your community supportive of your goals? Do you know where you could breastfeed if you needed to? And tied to that is get yourself some prenatal breastfeeding support. Knowledge is power. And so much of what we're about is empowering people to make the choices that they feel are right for their family and right for themselves. So get that education. We at Nest really stress your support system and identifying who's there to protect you, your partners, your work, the law, Nest, et cetera, and making sure that you have the tools to make the decisions that makes the most sense for you.
What do you think? Sometimes managing expectations and anything that we do is really helpful because then we don't feel so frustrated when we come across a challenge. In the first few days after birth are the most challenging. What are some of those tips that you could give an expectant mom of that time?
Yeah. I love this question. I love this question so much because everybody knows about the 3 trimesters, or hopefully you're pregnant for a full 3 trimesters. Everybody knows about the 3 trimesters that are, traditionally you have during pregnancy, but very few people, although increasingly so, are aware of what's called the 4th trimester. Babies in the first 3 months after they're born really kind of should still be inside of your body. They need to be incubating for a little bit longer. And so for us as a society to have an expectation that my baby is going to sleep through the night and my baby is going to know when 3 hours have happened and feed again. And, we'll follow exactly the textbook of what this book that I randomly picked up off of a shelf from my friend's cousin's uncle's sister told me is really not realistic at all. And I think that we do a real disservice to families setting them up with unrealistic expectations that their babies are just going to be robots. When the reality is that they need not intensive care in the same way that an intensive care unit would give you, but intensive care meaning responsive care. They need to be close to you. They need to hear your heartbeat. Think about what their body has been like for their entire existence inside of you. It's been dark, it's been warm. They weren't hungry. They heard the gurgle of your stomach and, the muffled sound of your voice. Being skin to skin with your baby and spending time with your baby and being responsive to your baby, I think really sets families up for more realistic expectations rather than sort of picking up a book off the shelf that's going to tell you to have your baby sleep X amount of time or eat, from this specific bottle or, whatever it happens to be.
What about, that's good advice. And how about patience? Because looking at expectations and patience with nursing, it's not going to happen like that. Even if you do have, I think hospitals do a wonderful job. I saw on your website is fantastic, by the way, just the resources on there. And even if you're not, it's a fee for service. So if you're not going to pay, you still can benefit from all of your resources on there. And one of the things is even when you're in the hospital, being patient with your baby and being patient with your own body.
Yeah. One of my favorite things to tell my patients is give yourself some grace. And I wish somebody would have told me that.
Yeah,
I have
me
a 3-year-old and I really wish someone would have told me that. And I was not able to take my own advice. But the reality is that the vast majority of patients that come to see me, and I think I can speak for the rest of my team when I say that the vast majority of patients that come to see them, really, if they trust their instincts, they're usually on the right track. They might need a little bit of tweaking here and there. They might need a little bit of, something that we know that they might not know. But trusting your gut, knowing your, mom or your birthing parent instinct, I think is a really important part of becoming a parent. And definitely a really, really essential part of becoming a breastfeeding parent, because your needs are so tied to your babies at the beginning. So giving yourself grace, giving yourself the space to step back and say, I'm overwhelmed right now, but that's okay. I'm going to take a minute. I'm going to take a breath. I'm going to take a shower, and I'm going to come back to it later. And it's patience, but it's also persistence. And again, knowing where to find support. If that means telling somebody else, I need you to do my laundry today, or could you make me some soup, or can you hold the baby because the baby's crying and I've just had a little bit too much right now. That's all okay. We all need help.
Right. Yeah. Yeah. Those first few weeks they all blend into one another and they are exhausting.
Yes.
That's great advice. I'm so surprised that you said that with your expertise, that just 3 years ago, you had the same thing. That's, I think, really good for listeners to know that even the expert that helps others, guides others, experiences stress and really has high expectations. But just sit back, chill out a little bit, right?
Yeah, we're all human. Even me, I feel like with all the letters after my name, I'm still a human. Just because the textbook says this is how my breasts are supposed to work and my baby's supposed to work, doesn't mean that that's how it's going to happen.
Yeah.
And I think that for me, I think I relied too much on myself and on my, brain and on science, which is sort of my MO. But I should have taken my own advice, and it's the same advice I give to other people is, don't be afraid to ask for help. One of the things that we have in our prenatal slideshow is one of the biggest myths is good parents don't need help. Good parents need help. Everybody needs help.
Yes. Oh, we all need help for sure. We're not experts. So when I'm thinking of going back to work, that was a big thing for me. And when I had my oldest, I was like in a back of a storage closet having to pump. It was awful. It was a clean storage closet, so I can't say that was awful. But just like there wasn't a lock on the door, so that was weird. But going back to work and wanting to still nurse, there's so many varieties of pumps out there and how to prepare for that. Does Nest have some help in that area?
Absolutely.
Okay.
Because we, part of the way that we've come up with this preventive care model is looking at when do people fall off the cart here? When do people deviate from their goals? When does society fail us? And one of those times is certainly going back to work. For some people, they may not have time or I, for example, was a doctoral student when my daughter was born. I didn't have any time off.
Right.
A lot of people have, hopefully somewhere around 12 weeks off-ish, maybe. And so we know that there's actually a significant decrease in breastfeeding at that point. So certainly that is a part of our preventive care model. We talk about it even as early as the prenatal visits. It's part of what we call anticipatory guidance, which is basically a fancy way of saying setting expectations with people. But our recommendations are going to differ depending on where's your baby being cared for when you're not with your baby. Is your baby going to be with you? Do you work remotely? Do you work from home? Do you work at a fast food restaurant? And or for example, do you work at a dry cleaner and you're exposed to toxic chemicals every single day?
Right.
Are you a medical student or a resident, and it's unlikely that you'll have time? We also make you aware of your rights to make sure that you are able to advocate for yourself with your supervisors, because often they're not aware of the updates on what they're required to do for families.
I wish we had more guidelines in place for maternity leave. That was the biggest thing, is like going back to work. And I just met a woman that she went back to work after 2 weeks. And she's in clinical research, and she just had to get back. And now our kids are old, 9, 10, and she's like, I so regret it. Like, I wish I would have done that. But, she chose to go back, and that's just sort of is Nest doing anything from a information legislation point of view of rights for moms?
So there's a big push for this. I'd say the best advocacy organization out there right now is the United States Breastfeeding Committee, USBC, and they do a lot of really wonderful work. They were integral in the recent Pump Act. I was just at their conference, and I know that they're very involved in the paid family leave fight. There's so many complicated things around this, but really, what all of us can do is to stand up and say, first of all, take your whole leave.
Yes.
Take your whole leave.
Yeah.
It always shocks me when managers in particular don't take their leave, because they're setting an example for their employees.
Right.
And empower people to take that leave, and don't penalize them for taking that leave. There is research that suggests that lactating parents that go back to work before 6 months are less likely to continue breastfeeding. But who has 6 months of leave? Basically nobody in the US.
Right.
So this is a big fight, and everybody's voice is needed.
Yeah, it's tough. I mean, from the employer standpoint, I think of, gosh, having someone gone for 6 months and paying them. I would love to do that, but I can't do that. And is that an opportunity where we could have some government subsidy to help come in if your business has a certain threshold? And even the hourly workers, we say that even with our own tests of, hey, check at home, so then you can avoid that visit to the doctor, and you can, still get into work. So there's so many challenges.
As an employer, also, there's other things that you can do. So even if you can't provide that long parental leave, we partner with employers as well, and so providing lactation support, and sort of like that, those wraparound benefits for those families to say, hey, we still support you. We might not be able to give you the world, but this is what we can give you. And we do know that patients that receive, employees from organizations that receive lactation support as a part of one of their employee benefits do breastfeed longer. But also, there's better retention, there's better employee satisfaction, there's lower healthcare costs for the employers. There's huge benefits. But lactation is sort of this little niche space that often people don't pay a lot of attention to, and so it gets a little bit neglected in terms of those benefits. But we are there to provide that benefit, and that is, part of what Nest does is partner with employers to be a benefit for their employees.
That's fantastic. If you are listening to this and you're at a big corporation or even a little corporation, ask if your employer will pay for Nest. And what's the average? How many people or how many visits does the average woman have with Nest?
It really depends. We have I've seen patients once, and we've had patients that have come to us over 20 times. It really depends on the situation.
Sure.
And often people will come to us more often when they don't have much of another support system. But for patients that have really complex situations, or they're inducing lactation, relactation, things like that, sometimes that takes a little bit more time. But to go through if you had sort of like a standard preventive care timeline, nothing ever happened, it's probably about 6 visits or so.
That's great. What a wonderful service. This is just an enabling technology to help moms in one of the most stressful but beautiful times of life. That's awesome for what you're doing.
Thank you. Yeah.
Yes.
There's not enough lactation. We already talked about there's not enough lactation consultants in this country, and they're often concentrated in major metropolitan areas on the coasts. So for us to be able to fill that gap in states and other locations where families don't have access to a lactation consultant, that takes their insurance, or they don't want to get out of the house with their baby, is really breaking down some major barriers to access to lactation support in this country.
Yeah, meeting patients where they're at is how we're going to move healthcare forward, and you're definitely doing it in the area of. Would that be maternal health? Is that what you categorize it? Yeah.
Yeah, it's maternal child. I mean, we get a little iffy with maternal health at Nest because we try to use non-gendered language, because there are people that breastfeed who don't identify as mothers, and that's we support every family in however they create their family. But technically, in the science community, yes, it is maternal health, child health.
Yeah, good. Well, it was a pleasure having you, Lilly. Thank you so much. If our listeners want to access more information, where do you send them? Website, but
Yeah.
do you have other opportunities?
So, www.nestcollaborative.com is our website. You can find our booking information there. You can find our blog there. You can find all sorts of, if you're interested, as a clinical partner, as an employer partner, as a durable medical, any of the different ways in which patients come to us, you can find our information on that website. And all of our IBCLCs are available to you. To support you throughout your journey. And we're thrilled to have the honor to do that.
That's awesome. Well, thank you so much for being a guest and sharing all of the wonderful guidance and support systems. Gosh, I can't think of how many words in this time of life that you would need a Nest Collaborative information. So thanks for joining us. And if you like this episode, I encourage you to go to Nest Collaborative. I think that this would be a wonderful baby gift if I was you, or if I am looking at a future way to use Nest as I am not of my child rearing years. I would give this gift to an expectant mother, because what a wonderful gift of support to have. If you like this episode, please give us 5 stars and be sure to subscribe, because then you can hear about our next episode that will be in 2 weeks from today. So Lilly, thank you so much for joining us. And until next time, keep on keeping yourself and your family healthy.